We will follow Michael's journey to learn more about acute rheumatic fever and rheumatic heart disease. This is Michael. He is 14 years old and lives with his family in his Aboriginal community. He loves to play football. He played football yesterday, and today he is limping with a painful knee. His Aunty Mary takes him to the clinic. Hi, Mary. What brings you here so early in the morning?
Hi, Jenny. My nephew Michael has a pain in his knee. Can someone have a look at him, please?
That's no good. Take a seat and I'll call the health worker to look at Michael.
Hi, Michael. Yes, your knee looks a bit swollen. How does it feel?
It really hurts when I try to straighten my leg and when I try to walk on it.
Michael, did you hurt your knee playing football? You played very well yesterday.
I'm worried about Michael. He doesn't get sick. The other kids get sick and complain, but not Michael. I'm worried because a couple of weeks ago, he had a sore throat and missed school. He's not been himself, and today he can't walk properly.
Auntie, I told you I'm okay. They make me shame. I'm already late for school, and my knee'll get better. It's nothing.
It's okay, Michael. Sometimes there is a connection between a sore throat and a sore knee, so Auntie is doing the best thing for you. Mary, what did you do when Michael had a sore throat?
I just gave him Panadol. That was about 3 weeks ago. I wanted to bring him into the clinic today to get checked out to make sure he's okay. Today, we're here about Michael's knee.
Auntie, you did the right thing to bring Michael to the clinic. He has a fever and his knee is painful. It might be that the sore throat he had 3 weeks ago was caused by a bug called Strep A bacteria. If it was Strep A, then Michael's sore knee should be checked out by the doctor. The Strep A bacteria can cause trouble for some people. Strep A bacteria, or germs, can be on people and we don't even know it. The bacteria move from person to person through touching, coughing and sneezing. They are so small that they can only be seen by a microscope. In some people, Strep A causes infection in the throat or in skin sores. The best way to stop Strep A germs moving from person to person is washing hands with soap and water and covering coughs and sneezes so that they don't spray around. Kids are affected more because they play and live closely together all the time.
I know Michael hasn't been well lately, but I don't understand this Strep A bug and how a sore throat can lead to a sore knee. Sounds like a nasty fella, this strep bug.
If Michael's sore throat was caused by the Strep A bacteria and he did not get treated with antibiotics, he may have acute rheumatic fever. This is what causes the sore knee. It can be very dangerous.
That sounds bad, eh? What is acute rheumatic fever?
Well, Michael, acute rheumatic fever is the body reacting to a Strep A infection that is not treated with antibiotics. Infections are usually in the throat or in skin sores. Your body has an immune system which is a bit like an army of soldiers that are fighting bad germs and bacteria in your body to keep you fit and healthy. In some people, the soldiers get confused. Instead of fighting the bad germs only, they also start attacking your body's healthy cells. When this happens in your body, this is called rheumatic fever. So, Michael, this might be what is happening in your body. Your immune system is confused. This might be what is causing the pain in your knee. Do you mind if I ask the doctor to have a look at you?
Yeah, okay.
Thanks, John. Good call. It's wise to be thinking about acute rheumatic fever with Michael.
Thanks. We had a case last week and he had similar symptoms. I think these are the most common.
What symptoms does Michael have?
Michael had a sore throat 3 weeks ago, but he didn't go to the doctors, so he didn't get antibiotics. His temp is high and he has pain in his knee and is limping around. Michael does not have any jerky movements or obvious signs of chorea. I don't know if he has heart problems, but I understand that these are also common symptoms of acute rheumatic fever. Michael, this is Chris, the doctor. She would like to examine you.
Hi, Michael. I understand that you've not been well and have a painful knee. I would like to do some tests to see if you have rheumatic fever.
We can do some tests here, but Michael will have to go to hospital to have other tests and be seen by a specialist doctor.
Oh dear, that could be a problem. Who will go with him? I have the other children to look after. What tests will he have?
Is there someone that can help you, Auntie, to go with Michael or look after the kids? Do you need to ring anyone? We'll do some blood tests here to see if Michael has had a strep A infection and take a swab of Michael's throat to see if there are still any strep A germs inside. The next few tests will be looking at Michael's heart, which can also be affected by acute rheumatic fever. We'll do an ECG, which will check how Michael's heart is working by showing its rate and rhythm. In hospital, Michael will have an ultrasound scan of the heart to see if there are any problems with the blood flow. This is called an echocardiogram.
My knee is really hurting. Can you give me some medicine for it?
I can give you some Panadol.
Okay, and then I can go to school? I can watch the footy game?
Okay, and we can come back later for the tests.
Not too quick, you two. It's important that Michael is checked out properly. If Michael has acute rheumatic fever, then there may be damage to Michael's heart, called rheumatic heart disease.
Oh no, that sounds serious.
Hey, Michael. Good to see you. How are you?
Well, I was in hospital, and a doctor explained that I had something wrong with my heart. It made me very frightened, but I don't feel sick, and I don't know why I need checkups.
Yes. The hospital report says you have mild rheumatic heart disease.
They explained it to me in hospital, but they use big terms. Can you please tell me again about rheumatic heart disease?
Sure. Would you like your auntie here too?
Yes, please.
Remember when you came to the clinic first before going to hospital? And you had a fever and painful knee. You had acute rheumatic fever back then. What we couldn't see was your heart was also swollen inside your body. Now, the heart swelling has gone, but the valves in your heart don't open and close properly, and they have trouble keeping all your blood flowing in the right direction. This damage is called rheumatic heart disease.
But I feel good.
It's great that you're feeling good, but you will still need to have checkups. We need to work together to stop the acute rheumatic fever from coming back. You will need an injection of penicillin every 28 days to protect you from the strep A infections. This is very important because if you get acute rheumatic fever again, it could cause more damage to your heart. This is what we do not want to happen. We want to keep your heart strong so you can keep playing footy.
I really don't like needles.
The penicillin injection has a few different names, but it's a type of penicillin that lasts for up to 28 days in your body. It's injected into the big muscles around the bottom or thigh. Have you thought about how you would like to have your injection?
I've been speaking to some other kids who get injections, and it's good that you asked me how I want them. I do like being able to think and prepare for the injection, but I don't like waiting for a long time every time I come in. I'd like the syringe to be warmed up, please, and I would like an ice pack put on the area to numb it. I can play my treatment tracker game while I'm given the injection, and then I'd like a warm pack ready for after the injection. I had some Panadol at home before I came here, and that'll work for a couple of hours. And I can take some more at home later.
That's great, Michael, and is a good plan. I'll write this down so that all the staff here know your injection plan. Let them know when you want something different. Michael, tell me about your appointments.
Well, I need my injections every 28 days to stop me getting acute rheumatic fever again, and so that my rheumatic heart disease doesn't get worse. I need to see the doctor here at the clinic every year for a checkup. And I need a scan of my heart every couple years to check the health of my heart. And I need to go to the dentist every year to keep my mouth healthy. I can get reminders on my phone, and Auntie keeps my appointment cards. I don't want the rheumatic heart disease to get worse, and I still want to be able to play footy.
Thank you, Michael, for sharing your story with us. By keeping up with injections and appointments and looking after yourself, you can keep going to school, playing footy and hanging with your friends.
People who live close together have a higher risk of getting strep A infections that can lead to acute rheumatic fever. Aboriginal and Torres Strait Islander peoples and Indigenous peoples from New Zealand and the Pacific Islands have higher rates of acute rheumatic fever and rheumatic heart disease than non-Indigenous people. Michael is one of 32 million people in the world who are living with rheumatic heart disease. 94% of people with acute rheumatic fever in Australia are Aboriginal and Torres Strait Islander peoples. Acute rheumatic fever is most common among young people aged 5 to 14 years old, but it is also seen in people up to 35 years old. The unique and diverse roles of the Aboriginal and Torres Strait Islander health workers and practitioners are central to keeping communities healthy. Thank you for your interest in ARF and RHD. Putting the information from this module into your practice can help keep your community healthy. More information is available on the RHD Australia website.